Does religion affect public health? Well, I'm going to read for you a list of healthcare related issues, and you tell me if they have anything to do with religion. So circumcision, abortion, blood transfusions, organ donations, the Ebola epidemic, HIV, end-of-life care, hallucinogenic drug use, alcohol use, contraceptive use, and vegetarianism and meat consumption in general. So all of these healthcare-related issues intersect religion in one way or another, sometimes more obviously than others. We often think of religion as beliefs and doctrines, as philosophy and ideas, immaterial things. But religion is something that we do. So almost by definition, religion is a relentlessly embodied experience. That is to say, we need our bodies to do religion. Our beliefs require electrochemical reactions in our brains. Our rituals require fine motor functions. So religion can affect an individual's health. But even more than that, religion is a relentlessly social thing. Religion is something that we do together in communities. So religious institutions and religious communities have an effect on the broader public. This is why the sociologist Dr. Ellen Eidler calls religion a social determinant of public health. But what does that mean? So the World Health Organization defines social determinant as the circumstances in which people are born, grow up, live, work, and age, and the systems put in place to deal with illness. These circumstances are, in turn, shaped by a wider set of forces: economics, social policies, and politics. A growing amount of research on income, education, and life expectancy has shown that our social circumstances can affect a broader population's health. John Green of the Vlogbrothers covered this recently, showing how your zip code, the neighborhood that you live in, is one of the most useful pieces of data to predict your life expectancy. But notice something about the World Health Organization's definition. It doesn't mention religion as a social determinant. Dr. Eidler's research sets out to change that. In her edited volume, Religion as a Social Determinant of Public Health, she identifies a few ways that religion can influence a population's overall health. Number one, religion provides social support. People in religious communities often have strong social ties with their peers, social ties that could lead to potentially greater material and emotional support in times of need. Social networks, whether that means attending religious services or simply being married with a robust social life, has been linked to lower mortality from all causes. Number two, Dr. Eidler also points to religion creating social control. Religious communities often try to regulate behavior, and this does have an impact on overall population health. So, for example, some studies have shown that people that regularly attend religious services have lower rates of cigarette smoking. However, it's not always positive. Religion can have a positive or a negative effect on a broader population's health. So, for example, in some religious communities, they might have higher rates of genetic disorders, especially in sectarian religious communities that have higher rates of intermarriage, like the Amish. Many Jehovah's Witnesses refuse blood transfusions, which has complicated surgeries in the past. And finally, religion can create social capital. By social capital, Dr. Eidler is referring to a community's institutions, whether they're economic, political, or religious institutions. Religious communities often create religious schools or religious nonprofits that can positively or negatively impact a population's overall health. But let me say that again. I'm not saying that religion always has a positive effect on overall public health. Religion is complex, and it manifests in complex ways in a society. So sometimes these effects can be positive or negative. But the point is, religion is a factor, and public health officials and healthcare providers should realize that and be aware that religion is a social determinant of public health. And sometimes they do a great job. In 2014, during the Ebola epidemic in West Africa, health officials worked closely with local religious leaders in conducting burial rituals to help mitigate the spread of the virus. And research such as Dr. Ellen Eidler's has shown that professionals are waking up to this realization that religion is a factor and they should take it seriously in matters of public health. But incidentally, if you're interested in this sort of topic, Dr. Ellen Eidler will be speaking at my institution, Boston University, in October 2017 for the graduate student conference Going Viral, religion and health. So if you're a graduate student that has research that intersects the fields of religion and health, you should submit some research. Go to my website, religionforbreakfast.com, to find out more. If you're not a graduate student but are local to Boston and would like to attend, the conference does have a few spaces open to the public, so check back in a few weeks when registration opens and come hear some really interesting research about religion and health. As always, thanks for watching.